I want to ask you something personal. How many times did you wake up last night? Once? Twice? Maybe 3 or 4 times? And when you finally got up this morning, did you feel rested, or did you feel like you had barely slept at all? If you are nodding right now, I want you to know something important before we go any further. You are not alone. And this is not just aging. 50 million Americans wake up repeatedly every night to use the bathroom. Most of them have been told the same thing by their doctor. It is your prostate. It is your bladder. It is just what happens when you get older. I am here to tell you today that in 80% of cases, that explanation is completely wrong. Your bladder is not the problem. Your prostate is not the problem. And the supplements, the pills, the herbs you have been taking, they are aimed at the wrong organ entirely. In the next 20 minutes, I am going to show you exactly what is actually causing this, why it is more serious than you have been told, and what you can do about it starting tonight. No surgery, no expensive procedures, no prescription medication. Stay with me until the end because the last section contains a simple evening routine that has helped hundreds of my patients sleep through the night. And if this channel is new to you, please subscribe and hit the like button right now. We are building this community on one simple principle. The healthcare system profits when you stay sick. I profit when you get better. Let me tell you about a patient I will call Robert. 68 years old, retired engineer, healthy his whole life, never smoked, moderate drinker, walked 3 miles every morning for 20 years. 3 years ago, he started waking up once a night. He ignored it. Then it became twice, then 3 times. By the time he came to see me, he was waking up 4 to 5 times every single night. He was exhausted, irritable. His wife was exhausted too because every time he got up, she woke up as well. He had already done everything the internet told him to do. He stopped drinking anything after 6 p.m. He bought prostate supplements. He tried herbal teas. He cut out coffee entirely. And he was still waking up at 1 a.m., 3 a.m., and 5 a.m., releasing half a liter of urine each time. He sat across from me with red eyes and said, "Doc, just tell me what's wrong with my prostate. I can handle it. I just need to know." I looked at his test results. His prostate was fine. His bladder was clean. From a urological standpoint, he was nearly healthy. So I stopped asking about how he urinated, and I started asking about how he lived. Did he get short of breath climbing stairs? Well, yes, a little. He had assumed it was just being out of shape. Did his socks leave a groove in his skin by evening? He pulled up his trouser leg and looked. Yes, actually, there was a clear indentation. And right there, the picture clicked into place for me. "Robert," I told him, "you do not need a urologist. You need a cardiologist and a sleep specialist." He looked at me like I had lost my mind, but he listened. And what those specialists found changed everything. I will tell you exactly what they found in a few minutes. But first I need to explain something that will make it all make sense. Before we talk about causes, I want to talk about consequences. Because most people think of nighttime urination as an inconvenience, an annoyance, something you just live with. It is not. Every single time you wake up from deep sleep, your body triggers a stress response. Your heart rate jumps, your blood pressure spikes, sometimes by 20 to 30 points in a matter of seconds. Your stress hormone cortisol surges into your bloodstream. Your body does not know the difference between waking up to use the bathroom and waking up because something dangerous is happening. It reacts the same way either time. Do this once, it is insignificant. Do this 3 or 4 times a night, every night, for months or years, and you have subjected your heart to thousands of unnecessary high-pressure events during the exact hours it was designed to rest. Research published in the Journal of the American Heart Association found that people who wake up 2 or more times per night to urinate have a 40% higher risk of cardiovascular events compared to people who sleep through the night. Not 5%, not 10%, 40%. Now here is the part about your brain that I really need you to hear. During deep sleep, your brain activates a remarkable cleaning system. Think of it as a biological dishwasher that only runs at night. It flushes out toxic waste proteins that accumulated during the day. The most important of these is a protein called beta amyloid, the same protein found in excess in the brains of Alzheimer's patients. This cleaning system only works during uninterrupted deep sleep. The moment you wake up, even briefly, the cycle is interrupted. It does not simply resume where it left off. If you are waking up 3 or 4 times a night, your brain's cleaning system may never complete a full cycle. Not once. Night after night after night. This is not meant to frighten you. It is meant to show you that what feels like a bathroom problem is actually a whole body problem, and it deserves a whole body solution. The good news, and there is very real good news here, is that in the majority of cases, this is entirely reversible once you address the actual cause. So let's talk about what that cause actually is. I want you to imagine something. Your home's smoke alarm goes off in the middle of the night. What do most people do? They cover the sensor with tape so it stops making noise. The correct response, obviously, is to find where the fire is. That is exactly what most people do with nighttime urination. They treat the bladder, the sensor, while the real problem burns quietly somewhere else in the body. Your bladder is not causing your problem, it is reporting it. In 80% of cases, the bladder is doing exactly what a healthy bladder should do. It is filling with urine and asking to be emptied. The question is, why is it filling so fast, so often, during the night? The answer involves 5 hidden culprits, and I am willing to bet that nobody, not your doctor, not any video you have watched before today, has ever laid all 5 of them out for you clearly. Let's go through them one by one. Culprit number 1, your legs. This is the most important mechanism in this entire video. I want you to really understand it because it changes everything. Picture a plastic bottle half filled with water. When it stands upright, the water sits at the bottom. When you lay it on its side, the water spreads out evenly. Your body works the same way. For most of the day, you are upright, sitting, standing, walking. Gravity pulls fluid downward, toward your feet and ankles. When we are younger, strong vein valves and active leg muscles pump that fluid back up toward the heart efficiently. But as we age, those valves weaken. The muscles pump less actively. Fluid begins to pool in the soft tissue of the lower legs. Up to 1.5 liters of fluid can accumulate in your legs during the day. That is 3 large mugs of tea, and you might not even notice it. The only sign might be a slight groove left by your sock elastic at the end of the day. Here's where it gets important. Your kidneys cannot see that fluid. It is sitting outside the bloodstream, parked in your leg tissue. The kidneys only filter what is circulating. Then you lie down for bed. The moment your legs rise to the same level as your heart, gravity no longer holds that fluid down. Everything that accumulated over the past 12 hours begins flowing rapidly back into the bloodstream. Your heart detects the overload. It releases a hormone, atrial natriuretic peptide, that sends an emergency message to the kidneys. Dump this excess fluid immediately. Your kidneys go into high gear, your bladder fills, you wake up. But the fluid from your legs has not finished mobilizing. 2 hours later, your bladder is full again. This is why people who have not drunk anything since 6 p.m. are still releasing half a liter of urine at 3 a.m. They are urinating through their legs. The fluid was stored there all day and the kidneys are processing it all night. No prostate pill, no bladder supplement, no herbal blend can stop this, because none of them address gravity. Culprit number 2, your heart. Early-stage heart failure is one of the most commonly missed causes of nighttime urination in people over 55. And I say missed, not diagnosed, not treated, not even suspected. Why? Because early heart failure does not always look dramatic. There is no chest clutching. Instead, the signs are quiet and easy to dismiss. Mild shortness of breath climbing stairs, slight fatigue in the afternoon, socks leaving a deeper groove than they used to. When the heart cannot fully circulate the body's blood volume during the day, fluid accumulates in the legs exactly as I just described, but in larger amounts. At night, that fluid redistributes and the kidneys are overwhelmed. If you are getting up 3, 4, or 5 times a night and you also notice any of those quiet symptoms, your first call should be to a cardiologist, not a urologist. This was exactly what was happening to Robert. His cardiologist found early-stage heart dysfunction that had been quietly developing for years with no dramatic symptoms. Culprit number 3, sleep apnea. This one surprises almost everyone. Sleep apnea is a condition where the throat relaxes during sleep and briefly blocks breathing. The person snores, stops breathing for several seconds, then startles awake with a gasp. This can happen dozens of times per hour, and the person often has absolutely no memory of it in the morning. Here is the connection to nighttime urination. Each time breathing stops, your brain triggers a stress response. This disrupts the production of a hormone called antidiuretic hormone, ADH. This is the hormone your brain normally produces at night to tell your kidneys to slow down and produce less urine. Sleep apnea repeatedly interrupts this signal. Without it, your kidneys run at full speed all night, producing large volumes of urine. Research shows that treating sleep apnea reduces nighttime urination by 50 to 60% in most patients. Not because anything changed about the bladder or prostate, but because the hormonal disruption driving the excess urine was finally corrected. If you snore, if your partner has ever mentioned that you stop breathing during sleep, or if you wake up feeling unrefreshed even after a full night in bed, please ask your doctor for a sleep study. It may be the most important test you take this year. Robert's sleep study showed 22 breathing interruptions per hour. He had no idea. Culprit number 4, Your medications. This one makes patients genuinely upset when they hear it, and understandably so. Many of the most commonly prescribed medications for people over 55 either directly increase urine production or cause fluid to accumulate in the legs, which then redistributes at night. Blood pressure medications called calcium channel blockers can cause swelling in the legs. Blood pressure medications called ACE inhibitors affect how the kidneys handle fluid. Diuretics, water pills prescribed for heart failure or blood pressure, if taken in the late afternoon or evening, hit their peak effect right around midnight. Antidepressants taken by many older adults can disrupt ADH secretion in some people, the same hormone that tells the kidneys to slow down at night. I am not telling you to stop your medications. I am telling you to have one specific conversation with your prescribing doctor. Ask this exact question. Could the timing of when I take my medications be contributing to my nighttime urination? In many cases, simply shifting the dosing time from evening to morning resolves the nighttime problem entirely. Same medication, different clock time, night and day difference in your sleep. Culprit number 5, what you eat after 6 p.m. You probably already know that salt is not your friend at night. But the hidden salt story is bigger than most people realize. 80% of the sodium most people consume does not come from a salt shaker. It comes from processed food, cheese, cured meats, bread, canned soups, condiments. 100 grams of ordinary hard cheese contains as much sodium as an entire bag of potato chips. You do not taste that sharpness because it is masked by fat and flavoring, but it enters your bloodstream with dinner and your body holds onto water all evening to dilute it. Then overnight your kidneys begin flushing that sodium out, and sodium pulls water behind it like a magnet. You wake up at 3 a.m. not because you drank too much. You are eliminating last night's cheese sandwich. Evening sugar works against you in a similar way. A cup of tea with cookies, a small apple before bed. These cause a blood sugar spike followed by a sharp drop 2 to 3 hours later, right when you have fallen asleep, during which the kidneys shift into active fluid excretion. And alcohol, a small glass before bed to help you sleep, is one of the most powerful blockers of that antidiuretic hormone we discussed. Under its influence, the brain stops sending the slowdown signal to the kidneys entirely. They run at full speed all night, so those are the 5 hidden culprits. Your legs in gravity, your heart, sleep apnea, your medications, and what you eat after 6 p.m. Before I give you the solution, I need to pause for something important. There are specific symptoms that mean you should not be watching a video right now. You should be calling a doctor today. Know these. Blood in your urine without pain. If you see dark red or brown urine or blood clots in the toilet and nothing hurts, that is a serious warning sign for bladder cancer in people over 50. Do not wait. See a doctor immediately. Pelvic or lower back bone pain combined with unexplained weight loss. If you have lost 10 pounds or more over 2 months without trying and you have deep aching in your pelvis or lower back, that warrants urgent investigation. A sudden dramatic change in your pattern. If you have been getting up once a night for years and suddenly you are getting up 5 times and nothing in your routine has changed, that sudden shift deserves medical attention. Fever with back pain and frequent urination. This combination can signal a kidney infection that requires antibiotics quickly. If none of those apply to you, take a breath. You are most likely dealing with a mechanical, hormonal, or lifestyle-driven problem, and that is entirely fixable with what comes next. Quick but important, there are 3 different types of nighttime urination, and the solution is different for each one. Type 1. You go frequently both day and night, and each time the volume is large. This is a whole body fluid issue, possibly related to diabetes or excessive fluid intake. This type needs a blood sugar check. Type 2. Your days are completely normal. You visit the bathroom every 4 or 5 hours without issue, but the moment you lie down, the trips begin. 3 or 4 times per night, large volume each time. This is the most common type in people over 50, and it is driven by the leg fluid redistribution and hormonal causes we just discussed. If this is you, everything in today's protocol is designed specifically for you. Type 3. Urges are sudden, urgent, and frequent, but when you get there, almost nothing comes out, a few drops. Then the urgency returns 30 minutes later. This is a bladder sensitivity issue and it needs a different approach. But the evening protocol I am about to share will still help calm the nervous system signals driving the urgency. Which type sounds like yours? Think about it as I walk you through the protocol. Everything I am about to tell you, I use personally, and it is exactly what I walked Robert through. I call it the 3-window protocol because it works across 3 specific windows of your day. Window 1, morning, 1 minute, the moment you wake up, before coffee, before your phone, stand up and do 30 heel drops. Stand with feet shoulder width apart. Rise up onto the balls of your feet just slightly, then let your heels drop back down with a gentle, firm impact. You should feel a mild vibration travel up through your calves, 1 drop per second, 30 seconds total. This activates the venous valves in your legs from the very start of the day, encouraging blood to move upward against gravity before fluid has a chance to pool. The earlier you start the pump, the less fluid accumulates by evening. If standing is difficult, do this in bed instead. Raise both legs and both arms straight up and shake them gently for 60 seconds. It looks a little silly, but it activates lymphatic circulation effectively. Window 2. Afternoon. 1 change. Shift 70% of your daily fluid intake to before 3 p.m. A glass of water when you wake up. Fluids with breakfast and lunch. Tea in the early afternoon. After 3 p.m., begin tapering. After 5 p.m., only small sips as needed. You are not restricting fluids. You are shifting when you consume them, so your kidneys do most of their work during the hours when you are awake and in control. At the same time, remove the salt shaker from your dinner table tonight. Season food only during cooking. That one change alone reduces your daily sodium intake by 20 to 30% without changing a single recipe. Window 3. Evening. The most important part. 60 to 90 minutes before bed, lie down on your sofa or on the floor and raise your legs. Rest them on the armrest of the couch, the back of a chair, or prop them against the wall. Your heels just need to be higher than your heart. A 30 to 45 degree angle is enough. You do not need to go fully vertical. Stay there for 15 to 20 minutes. Read, watch something, listen to music. You do not need to do anything specific. What is happening during those 20 minutes is simple physics working in your favor. Gravity is now pulling that stored fluid from your leg tissue back into your bloodstream. Your kidneys detect the increased volume and shift into active filtration mode. Your bladder begins to fill, but you are awake. You are in control. 30 to 40 minutes after you finish, you will feel a strong urge to urinate. Go. You will release 300 to 400 milliliters, the exact volume that would otherwise have woken you at 2 a.m. You are deliberately draining your legs before sleep. You are giving your kidneys their work in the evening while you are awake, so that after midnight they can genuinely rest. If your legs show visible swelling or leave sock grooves by evening, add graduated compression stockings. Put them on when you get home and wear them until your shower. They prevent fluid from pooling during the evening hours. Remove them before bed. They are an evening tool only. The final step. In bed. Lights off. Eyes closed. Before you sleep, do 20 to 30 pelvic floor contractions. Most people do this incorrectly. They squeeze the buttocks or tighten the stomach. That does nothing. The correct way. Imagine you are trying to stop passing gas, or picture your pelvic floor as an elevator rising from the ground floor to the 5th. Your abdomen stays completely soft. Only the internal pelvic floor muscles engage. Contract, hold for 3 seconds, slowly release. 20 to 30 times. This calms the nervous system signals to the bladder. It tells the brain, muscles are holding, system is stable, we can rest now. The bladder stops firing urgency signals at small volumes and settles into a calm, normal operating mode. That is the complete protocol. Morning, 30 heel drops. 30. Afternoon, fluids front-loaded before 3 p.m., salt shaker off the table. Evening, 15 minutes legs elevated, bathroom trip, then 20 to 30 pelvic floor contractions before sleep. Robert did this consistently for 4 weeks. He went from waking up 4 to 5 times per night to waking up once, near morning when the bladder is genuinely full. His cardiologist noted at his next visit that the swelling in his legs had improved significantly. His heart was working with noticeably less strain, because when you address the actual cause, the body responds. Here is what I want you to take away from today. Your body is not broken. Your bladder is not your enemy. It is a signal light on the dashboard telling you something important is happening somewhere else. Now you know what it is saying, and now you know how to respond. Your 5 action steps for tonight. 1. Press your thumb firmly against your shin bone just above the ankle. Hold for 10 seconds. Release and check whether a pit remains. If it does, fluid redistribution from your legs is contributing to your problem. 2. On your next day off, track your urine separately by day and night. If more than 1/3 of your total output is happening at night, you have nocturnal polyuria driven by a root cause, not a bladder condition. 3. Tonight, remove the salt shaker from your dinner table and replace your evening snack with a small handful of raw pumpkin seeds. 4. Tonight, 60 to 90 minutes before bed, elevate your legs for 15 minutes, then go to the bathroom. 5. In bed, do 20 to 30 correct pelvic floor contractions before you close your eyes. And if your thumb test shows a pit, if stairs leave you short of breath, if your shoes have been fitting tighter by afternoon, your first appointment is with a cardiologist and a sleep specialist, not a urologist. Your doctor is not going to walk you through any of this at your next appointment. There is simply no time. And there is no financial incentive to explain fluid mechanics and pelvic floor neurology in a 12-minute office visit. That is exactly what this channel is here for. Subscribe, hit the like button, and tell me in the comments, how many times are you currently waking up at night? I read every single comment. Your answer shapes what I cover next, because the more I understand what you are going through, the more precisely I can help you.